The AI does the scribe does the recording. It generates a note in a SOAP note format. The AI is really great right now at trying to include so many things like medications and stuff like that, and past medical history. I think with the scribe, we have never had to do that, which is pretty cool. Like, you guys are able to pick it up, our voice. Another thing is it also picks up languages. So the patient is speaking in a different language, it translates. Yeah. It's really cool. The idea of, the Kyla app is great in that at the end of the visit, it generates a discharge instruction. So it captures everything that I've mentioned to the patient about how to take a certain medication, what I'm prescribing, what's the next step, when's the follow-up. Sometimes as a patient, you come in very sick, you get really overwhelmed, and hearing something one time might not stick, and having that to go back to, I think it's vital for the patient. Much time is saved using an AI for charting versus manually. So let's just go back and think about maybe a simple visit, right? And I was mentioning maybe it takes me about 5 minutes. Well, with an AI, I'm going to say it cuts down more than half the time. I do a lot of patient education. I love empowering patients, and so I talk a lot. And when you're spending a lot of time interfacing with patient, and then you leave the room and you're already kind of tired, and you don't want to have to retype all of that. And so the AI captures that conversation and allows me to just plug that into my notes and just make little edits as I see fit. And not having to go back and remember everything I've said to the patient or everything the patient said to me. The other thing is I really enjoy the aspect of kind of summarizing in the assessment from the scribe about, okay, here's the chief complaints and the symptom that the patients are experiencing. Here are my differential diagnosis and how I come about to one possible, diagnosis, and why that, coincide with the patient's symptom. And not only does that help whoever looks at my chart, or even me the next time the patient comes back, but it also tells tells insurance, or tell imaging center, even pharmacy, the medical necessity to why we prescribe certain treatment plan. Yeah, with manual charting, the biggest chunk of the SOAP note that I spend on would be the HPI, so what the chief complaint, what the patient states, and then the action, the assessment, and the plan. So the assessment involves what my assessment is and what my differential diagnoses are, and that the plan would be what I plan to do for the patient. I would say, if I'm seeing on average a day of 25 to 30 patients, I would not be able to get all that charting done, on a 12-hour shift, and that would, then I would have to take that work home, and I'd probably spend a good chunk of time at home, I would say 5 to 6 hours charting.